Two. Good afternoon, everyone. Thanks for joining us again today. I posted earlier on my Facebook page a reminder about today's Facebook town hall. It just was a moment to remind us that for me, I'm now in my 9th year as county executive, and we have held over 150 town hall forums throughout those 9 years. Obviously, up until 2020, those were in person in many cases, but these last 11 months, I think we're in the 50 neighborhood. I think 47, says Sean, who is 6 feet away from me with a mask on. 47 town halls since we began reporting to you regarding this pandemic. I just would note one of the things that we take a lot of pride in is that we answer your questions. So if you have a question, write it in the comments section below the live feed, and we'll be happy to get to as many as I can this afternoon. First and foremost, I trust and hope that you had an enjoyable Thanksgiving. I know that it was it was like every other holiday these last 11 months, a little bit different. I hope that you took steps to provide for your own health and the health of the people you love and care for, that you followed sort of those protocols that we've talked about these last few months, that you kept it small but found ways to still interact with loved ones. And I, for one, want to express on behalf of the people of Dutchess County not only our gratitude to all of you, but also our deepest sense of sympathy, condolences, prayers, and thoughts for those of you who had to celebrate Thanksgiving with the loss of a loved one, whether they lost their fight, if you will, with this virus or for some other reason. This has just been a challenging year for so many in so many ways. So I'm very hopeful that you were able to enjoy some peace of mind and time, either physically with your immediate family or virtually with friends and family. And I mean that quite sincerely. Let's jump directly to the dashboard and some of the data points so that you are up to date. We are approaching 290,000 tests, 289,001 tests conducted. I'm going to talk a little bit about testing this afternoon, but I will say this. There is, I think we know, a national challenge to give access to everyone who either wants or needs access to a rapid or a PCR, the traditional diagnostic testing. That is a national challenge, and we are experiencing this all across the state of New York. So only months ago, 7 months ago, you may have waited a long time to get access to a test. Several months ago, you may have had to wait just a shorter period of time. We're back to those longer waits, and a lot of that has to do with accessing the very components of the test itself. So we're taking some steps at the county level to be prepared to assist as it relates to these microclusters, but be patient with your physician. We've worked very hard these last couple of days, in fact the last week, to communicate again with healthcare providers. We want to be sure that people who need access to a test have it, but again, the system isn't made to support, how should I say, non-essential testing, that even though we want people to be tested, there just isn't enough access in New York or likely anywhere else in the country with situations like if you're on a travel team or something where they might want you to be tested every week. Some of those things are just not able to be attained in the period of time you'd want them. But remember, if you need to be tested, a couple things. If you feel that you've contracted the virus, your first and most important step is to begin to isolate yourself and then contact your physician. And in those scenarios, accessing the testing is more readily available. You should also think about the people that you may have come into contact with. For instance, in my own life, right? If I thought I had contracted the virus, I'd be talking to people who maybe came into close proximity to me over a period of time and saying you may want to be aware of that. Contact your physician, and the physician is to attempt to accommodate you in accessing a test. If you have broader questions regarding testing, you can visit dutchessny.gov. Coronavirus testing. We do have that information available. Keep in mind that the providers that are available for testing They change their expectations quite often. We have a good relationship with a number of those providers. They're doing their best, and we're very grateful to them. But it is a challenge, and it's not unique to Dutchess County. We have made a request to the state of New York to reopen a drive-in or drive-through testing facility in the Dutchess County area. Right now, the only regional location is at Bear Mountain. There is, I think, a location in Albany as well. But our goal is to provide broader access. Now, again, I'll talk a little bit more about testing in a moment. So let's just jump back to the numbers. 289,001 tests completed over the course of these last 11 months. 7,354 confirmed cases. The number important at this moment is 664. That is the number of active cases that the Dutchess County Department of Behavioral and Community Health is monitoring. Within that, the second and really the most critical of the data points we watch is hospitalizations. We're now at 64 hospitalizations. That has been a steady increase that is alarming, I'm certainly not attempting to frighten anyone. Our hospital system is currently stressed. We are about half of our peak in COVID-related hospitalizations, but there are a couple realities. The pace of growth in hospitalizations is not something the system can sustain for a long period of time. Secondly, those who are hospitalized, admittedly, many are advanced in age. Some could return to, let's say, a nursing home setting or some sort of care setting, but under the circumstances won't because of the contagious nature of COVID-19, and their time in the hospital is becoming prolonged. Now, add to that when the state took action earlier in the year to restrict hospital activities like elective surgeries. People put off, and to some degree put off procedures that we just can't put off for long, and in some cases shouldn't at all. There is sort of a surge in elective surgery demand and need, and so our hospitals, and I will also admit it's one area that they can generate enough revenue to stay open. So the hospitals are taking on the elective care surgeries that were sort of held back. That's sort of a surge. Add to that a rate of growth in hospitalizations as it relates to COVID-19 in this pandemic, and the length of stay in hospitals is a bit prolonged. That is compounding a challenge for area hospitals. Now, at our peak, we were at 108 hospitalizations. That was a number that was concerning, and it was concerning in the context of also having capacity because of the a pause of elective surgeries. The pace that we are growing in the region in hospitalizations is alarming, and it is something that the hospitals and we have been working to prepare for. I will say that our hospital infrastructure, the administration has been tremendously responsive. They will say what I'm about to say. We kind of know the playbook. We didn't know necessarily looking forward what the response would be to an infectious disease like this. Looking back, we know a little bit of the blueprint. We know some of the things, and we know a lot more about the disease, the virus itself. So they're more prepared. I will offer to you that the concept of a secondary care facility is not something that the hospitals think is necessary at this point, in particular because the people who are being hospitalized, and this is an area of concern, demand hospital level care, and you can't just create hospitals, right? So what we had prepared for was almost a recognizant, right? Is that the right term? Facility, sort of an alternate care facility where you step down and get a lesser level of care. The hospitals are pretty certain that those who are hospitalized today deserve and need that hospital level care. So we do have a couple options. We continue to work across the river. The Westchester Medical Center network, which of course is Mid-Hudson Regional here in Dutchess County, has a surge capacity which is open regionally in Ulster County. That provides us some opportunity, but I just want you to be aware of that concern. So let's jump quickly again to the numbers. So 664 active cases, 64 hospitalizations. We have seen 191 individuals succumb to the disease. That's we've had a dozen deaths in a dozen days. I think about 11 deaths in 10 days. 10 deaths in 11 days. but about a dozen deaths over the last couple of weeks. And our regional positivity rate is 4.7%. Let's just look back 2 weeks ago to today. 2 weeks ago, we were monitoring 664 active cases. Today, 576. That's because, again, as people recover or move off of the necessity for, I got that right, yeah. Did I switch it? Today, I switched it. 664 today, 576 2 weeks ago. I apologize. I knew that and reversed it. Again, rate of growth, pretty steady. The peak of active cases, 1,860. Again, 64 hospitalized. Today, 32 a week ago, 2 weeks ago, and 108 was our peak. Those are areas of concern. As I said, 4.7% regional positivity rate, which is about, I think, at the sort of the higher end of average in the state, but nevertheless, regionally, 4.7%. You can see the localized numbers. Dutchess and Ulster continue to have the lowest in the region. That's just, I just offer to you, it's a number. It is not something that we should say, we've done something remarkably different than some others. I think you all are doing your level best to follow the protocols, to engage in some of the protection, the mitigation we've talked about. We're fortunate that our numbers have remained a little bit lower than the region. We're at 3.5% average, 3.6% yesterday. So if you look at those numbers, positivity rate in Dutchess 3.6%, Orange County 6%, Putnam 4.8, Rockland 6.1, Sullivan 2.4, Ulster 4.9, and Westchester 5.3. You can see the 7-day rolling average, and that is obviously something we're monitoring. Now, we said this last week. Early on in the pandemic, we saw cases sort of emanate. After they were clearly positive cases in America, and we clearly had positive cases before we were even monitoring them. But as we saw the cases come come about in the East Coast, we saw them emanating from New York City, and then New York City sort of north, right? And then from west to east, from east to west. So New York City north, and then we saw cases kind of grow from East New York west, and then west to Western New York and beyond. We've almost seen the reverse these last 6 weeks. We've seen cases rise in the Midwest. We saw cases rise in Western New York. My friends in Erie County, we work very closely with the county leaders there. They have seen just an astronomical increase, and it is really, really alarming to them. You see the growth of those cases coming almost from west to east now. So we're going to continue to monitor. I just want you to be aware of that. It is not my desire, nor do I want people living in fear. We want to just be aware of the information and take those steps we've talked about, those protocols that would provide for our own benefit. So let's jump through a handful of questions. Isn't that great? Thank you. Let's get through a few questions. Karen, are you reducing county employees? If you mean, are we laying off county employees? No. If you mean, are we shrinking the number of employees working in county government in the office? We're not taking that step yet. Those employees that are identified as vulnerable have been working from home. The overwhelming majority of our employees are reporting to work. We're following basic protocols. We've been able to, thankfully, mitigate any concern in virus transmission. I will say this out loud, and is like anything else, during an emergency is when residents, when our neighbors expect government to be as functional as possible. At the moment, we're not reducing the footprint. We're not shrinking the number of people who have to report to work. We do have contingency plans in place. We are prepared to do that when we think it's necessary. As of this point, we are not moving forward with any organized reduction. But if you're an employee or you have an employee that has a particular vulnerability, they speak to their supervisor. There's a process for that, and we've accommodated those who need to work from home. If you're asking, are we eliminating jobs or laying people off? We are not. But if you want to follow up, if I didn't get the question right, feel free. Susie, even though people are sick, they can't afford to stay home 2 weeks. You are absolutely right, and I understand that. Believe me, I do. That is absolutely true. However, these are the protocols that are in place, and it's for their health and the health of others. Now, if someone is tests positive, If I remember correctly, there are federal and state protections for employees, and if you have an employer or know of an employer that isn't accommodating that individual, then the New York State Attorney General's office and others are empowered to be of some assistance. You are absolutely correct. You can't stay home and not get paid, but at the same time, the protocols are such that we just cannot. It is not sound or safe to go off to work if you are ill. So please don't do that. And if you have an issue with an employer, the New York State Attorney General's office is the appropriate place to turn. You can visit us at duchessny.gov, and we'll provide you that connection. And employers are to be accommodating. That is the goal under this state of emergency. Kimberly, son and roommate were exposed and tested 7 days ago. No results. How is this delayed testing results, and are they considered in the decisions made? I think we're asking for a bit of a clarification, but let me say this. You are correct. A standard PCR, standard diagnostic test, you might get that. You could likely get that result within 48 hours, but it is between 48 hours and 14 days, and that is the demands on the laboratories. This is not unique to Dutchess County. It is not unique to New York State. And I will say this: it is the earliest failing that we experience nationally. The capacity to adequately test and get results quickly really made our national, and I'm not saying any layer of government, all of us, our national response. It really delayed the ability to control the transmission of the virus. That is a reality. So when you say is it considered in decisions made, well, first only until the positives are what's counted, right? So I mean negatives are counted. We know how many tests are conducted. We actually get that question often. Do we consider the people who test negative? Well, yes. The total number of tests, 290,000. Versus the numbers of positive, that creates for us this positivity rate that we use to kind of sort of manage it. We do this for the flu as well, and some have asked, what happened to the flu? We're not paying attention to that. We are. New York State has a flu tracker. We do the same every year. You can follow or visit the New York State flu tracker and get information about the common or more traditional flu. That said, again, to answer what we think is the question, and that is. Okay, I'll do that as well. I'll do that as well. So to answer what we think is your question, we are aware of the test issued, and we await the positive. If it's positive, obviously it affects the decision making, meaning are there additional protocols that need to be put in place? That is the way in which those decisions are made. Crystal, any areas of Dutchess approaching the yellow zone? I mean, the short answer is let's pull up those zones so people know what we're talking about. This is actually a very good framework. It's very useful. The state has devised. They refer to them as microclusters. The truth of the matter is it's a geographic area where we know we have a level of spread that is of concern. Yellow, orange, red. Yellow, standard, right, be aware. Orange, a little bit more hazard. Red, full stop. That's basically the state's expectation. If you exceed in a geographic area, could be countywide, but it's not. The state looks at the smallest, and that's why it's micro, the smallest geographic area that they feel is appropriate. Could be a census block, which you and I wouldn't know of. You wouldn't know the census block unless you ran into one, or it could be a zip code or a municipality. I will say offhand, it is likely we are approaching a designation for a yellow zone in a particular community in Dutchess. We won't know that immediately. So if you ask me today, I couldn't say tomorrow there's going to be a number. But what we do know is that, and the reason is the data that the state uses is twofold. One, 3% for 10 days. So the positivity rate over a 7-day average must be 3% for 10 consecutive days. And keep in mind, that could start and restart over and over again. That we know a little bit about if it's a zip code or a municipality because we get those numbers. If it's a census block, different. We don't know numbers based on census block. The state does, and they manage that data. Second, must have 12 or more daily cases per 100,000 residents on a 7-day average. So that said, we don't have just sort of regular information that would provide us that clarity in a census block. So again, the state of New York would provide us advance notice. My experience with my colleagues on the counties that do have those designated areas is that the state Department of Health will communicate with our Department of Health, and the governor's office will communicate with our office 72 to 48 hours before
This is the same lady on the same topic.
Okay. Oh, we can just keep going. Okay. And they communicate with us. They give us some advance warning. We get to see some of the mapping so we can make some judgment calls with them. And then we would have to, the state would announce those zones. Now, again, there's some good to the framework because it kind of identifies an area where we want to try to control and slow the spread. But the reality is that in a community such as ours, a zip code, let's say 12601, if you shut down and restrict activity there, that's not to say that folks wouldn't be going to 12602 or 12603 and vice versa. So there's some reality that gets confronted there. Let me, Susie's asking a similar kind of question, are we close to closing businesses? So again, these are decisions that the state of New York will make, and they'll do it with our counsel, but still it is the state's decision. These are if you see them here, these are the categories: red, orange, yellow. Yellow would reduce certain indoor activity capacity, which is very close to what we're living in today. Orange, but there'd be a testing requirement to keep schools open. Orange, which is a bit as referred to sort of a warning zone. This is where it's getting escalated a little bit more. That would reduce certain higher risk activities like gyms, fitness centers, as the state decides them, hair salons, personal care, etc. And then red is closure. We are not. We're not saying we're going to jump from where we are today to orange or red, where you'd see some of those closures. So at the moment, depends on what your definition of close is. We have not identified a cluster area that would require advancement to any of these categories. The state and the governor announced 2 days ago that the state is sort of retooling some of the framework because they want to also manage and monitor hospitalizations in these categories. So the state and the governor will talk a little bit more about that, and we'll provide you more information. Legislator Chris Munn, which I appreciate you watching, and offer that we try to answer legislators' questions on Facebook and any other time, referring to some reference that we're quoting Monday's numbers. I'm providing what are our current dashboard numbers. It is accurate that we get our data from the state. So the state data gets inputted, it gets updated to our data, and then we're almost always 24 hours behind the initial caseload. But it is true the cases are continuing to increase. So I do want to thank the legislator for identifying that in the comment section of the live stream. But I will say this, and it is on the agenda today. Let's talk a little bit about where we're seeing our cases, and the majority of cases in Dutchess County are coming from socialization. We acknowledged this ahead of Thanksgiving, and I will say again what we said last week. Thanksgiving followed by Hanukkah, followed by Christmas, followed by New Year is just a recipe for more cases. Now we can choose to take certain precautionary steps, those protocols we've talked to, physical distancing, keep your gatherings to small and what's necessary, obviously personal hygiene, and monitoring your own health, and wear a face covering, wear a face mask. In doing those things, we slow the rate of growth. Now, 2 weeks ago, we had the Commissioner of Orange County talk a little bit about masks, and some people are likely already saying it or have said it. Well, people have been wearing masks, and it's not slowing things down. What's been said is in the countries that are between 60 and 80% regular compliance with mask and face covering, several Asian countries are reaching that level of sort of following those protocols. They're seeing a drastic reduction. The truth of the matter is people are choosing to either follow the protocols, to use them, or not. I encourage you to follow them and to take those steps that would provide for your health and the health of others. Remember, the concept here is just to be considerate of your health and the health of others. You take these steps, we slow the transmission. We will. Yes, we are going to see more cases. The goal here is to make personal decisions that are considerate of our health and the health of others. So, community and socialization, small gatherings and hangouts, those are the primary cases that we're seeing, which is both good and bad, right? We're not pointing to an area where there's a significant cluster, significant rate of growth, and that's the area to be alarmed about. Good in the sense that we don't have one of those that we're monitoring at the moment. Bad in that it's sort of generalized community spread, which means everyone is affected in some way. I think it was Dr. Birx from the federal government spoke earlier this week and said, assume that you have it. And the irony is that there were people who were alarmed and she received some backlash. we have all been saying this for months. Assume that you have it and take the steps to slow the transmission and protect your health and the health of others, and that means we will be safer. So we acknowledge that is where the key spread is. Household, someone in your immediate family becomes ill, infecting someone else in your immediate family, or again, sort of that social interaction. To the woman who said, they can't stay home. Yes, likely people who are symptomatic are going to work. You need to take those steps because the system cannot sustain the rate of growth that we're experiencing. And again, not to be alarming, this is the truth. We only have so many beds. We only have so many ways of keeping care of folks. There are staff shortages. Those are all things at the hospital and healthcare level. Those are all things that we have to be considerate of. At the same time, be considerate of health. Nobody wants this virus. Believe me. Yes, most people will overcome it. Yes, it is a real virus. Yes, it impacts people. And yes, we are seeing a growth in hospitalization. All of that is of concern. Josephine, if you don't have an adequate number of tests available, what will happen with schools? So going back to those categories, it's a great question. So going back to those categories, remember what the state of New York says is if you enter into one of these zones, so starting with yellow, schools can remain open if we conduct testing of 20% of the staff students every 2 weeks, right? In that particular school district. So first, a school needs to make that choice. It's not up to me. It's not up to the governor. It's up to the school. Does the school want to remain open under those conditions? And if they do, we will have to conduct the ongoing testing in order to sustain them. Now, the same is true in red and orange. If you move into red and orange, you can conduct the testing to move out of red and orange. This was actually an advancement that the county executive in Onondaga County had made as part of our negotiation and ongoing conversations with the state. You can test out of the zones. Here's the thing. Step one, school district needs to want to engage in that. Step two, we need to have access to testing. So the experience that the counties that have already had these zones have seen already is that the state does claim that they will make available the basic test strips. Dutchess County, with our partners in New York, does have access to the test machines themselves. Abbott is one of the producers of these test machines. So we will have some access to those, and we will, in certain circumstances, be able to sustain some testing. The question is how many microclusters, how many schools, and what are the size of the schools? As for instance, the graduating class at John Jay High School is larger than the entire Red Hook High School. Red Hook is in a microcluster, and we have to test 20% of that population, slightly different than having to test 20% of the population at John Jay. What we're also doing and are prepared, and this is not unique to Dutchess, and I know there was some concern that it is. It isn't. Every county's in this boat. Some districts have chosen they don't want to open, they go remote, there's no need to test. That's their choice. Working with the counties, they can decide if it's something they can engage in. I will tell you, we want kids in school. The governor has said so. We believe this. We see the rates of transmission much lower in schools than it is in a less restrictive environment. School districts have done a relatively good job responding to cases with the health department. So we want kids in a school setting. If a school wants to remain open, we enter into this yellow zone. We have organized support from our urgent care providers. So organizations like Pulse MD will have access to testing. We've coordinated our own purchase and use of test kits. We will do that in coordination and cooperation with the schools. School districts will be expected to provide staffing. We can train folks how to do the testing. We're prepared to do that. We will have some staffing, both county personnel and volunteers. And we've worked with and are working with our hospitals to provide access to the testing. Can't mandate somebody take a test. So we'll be able to move in, and we have a testing, in essence, a test army prepared to move in, but it is not sustainable if it's multiple clusters with increasing rates. So, Josephine, the short answer is we're going to work with districts to try to stay open if they choose. We will do our best. We're making some purchases. We have a line, as I said, of supply through the state as it's available. But the more clusters that exist and the more challenges to remain open will really shrink the capacity of the state and others to meet that testing need. I do want to tell you, and this is based on now testing that was conducted over the last 24 hours, we are now at 5.7%. Dutchess County's, no, I'm sorry, the region's 5.7?
No, we're 5.
We're at 5.7 now. So Dutchess County is now at 5.7 in the positivity rate. So without question, we need you to continue to take those steps, follow those protocols that we've talked about. Small, again, keep those social interactions small, physical distancing, wear the face mask, face coverings, engage in personal hygiene, and monitor your own health. And if you have symptoms, do not go off to work. Do not send your children off to school. It just is a challenge. The other is offer to you not only for your own health. Remember, if you go off to work and you test positive and you've come into contact with 2 unsuspecting coworkers or other students, they can get sick and they will have to be quarantined as well. So these are the choices, these are the steps we have to take in order to be safe, and we encourage you to please do that. If you have a question, write it in the comment section below the live stream. Let's very quickly go through a few other points. You can continue to follow us on Facebook. Dr. Wythian, I know Wythian, our Commissioner of the Department of Behavioral and Community Health, is an infectious disease doctor himself, providing regular updates. We encourage you to take a listen. If you have questions or comments, you certainly can post them. He tries to get to some new thoughts every Monday and Friday, based on what comments and questions come up throughout the rest of the week. Now, he spoke most recently about the steps you can take if you do test positive. Remember, we kind of reinforced them. You can help in the contact tracing. You can be the contact tracer, meaning if you know of someone you've come into contact with, excuse me one second. I bet you appreciated that. Thank you. There are steps that you can take. You come into contact with, notify the people that you're in close contact with and let them know that they should begin to isolate themselves and will want to be tested. You can, you should reach out to your contacts and let them know they might be contacted by a contact tracer. And please, if you get a phone call from a contact tracer, just take the call. I promise you they're not going to ask some probing questions, and they're not trying to get information that is unnecessary. The goal is to help you identify for your health and the health of others, those who might be impacted by the virus. So those are things that Dr. Wythian has been talking about. Again, we've talked a little bit about what the state has been, what updates have come from the state as of the state has sort of launched this winter plan, if you will. I do want you to know that the county governments across the state have been coordinating really unlike any time before. We have been on regular calls with the CDC and federal agencies. We've been on the call with the New York State Department of Health and the governor's office daily. We are working with our hospitals on both testing and hospital capacity, and also vaccine distribution, and we are working together to confront this next wave, if you will. So these are the things that the state is identifying. Again, these are all some of the topics we've already kind of covered. But as of today, we don't have an identified microcluster. As I mentioned, we don't have access to all of the data points the state uses. But based on what we know, we clearly are on the verge of one. I couldn't say yet where, but we definitely have and are preparing for what will come next. So we ask you to be vigilant. Remember, the choices we make can provide for our own health and the health of the people we care about. And we've talked about those protocols. I do want to remind you again, small. Keep those gatherings small. Remember, wear a face mask, a face covering, physical distancing, personal hygiene, and monitor your own health. All of that critically important. Remember, the state of New York, along with New Jersey and Connecticut, have travel advisories. And if you do travel outside of those states that are adjacent, and of course the state is asking, and we all ask that you keep the travel to even those adjacent states to essential. But if you travel outside of the immediate region, there is a testing regimen. The goal for you is if you're going to be outside of the state of New York for more than 24 hours, within 72 hours before returning from that location, you're expected to test negative, but to test. And then when you come home, you're expected to quarantine for 3 days, and on the fourth day, get tested. And again, stress on the testing system. Be aware of that so that you know if you are traveling, you can try to schedule a test when you come back. So it's best almost to go online to visit with your physician and try to get that test scheduled several days out. A lot easier, more timely than if you come home and then try to schedule. It's just the stress on the system. Now we're keeping as much access open for emergency responders and others as we can. And as I said, we sort of have assembled this testing army kit, if you will, that we'll work to deploy if and when we have a cluster's designation, and if a school district is interested in remaining open under those circumstances. So, if schools close, will lunches be available for students? Yes. The schools are required to maintain access for subsidized lunches. That is something that most school districts have been very good at. I think all, but we did hear some concerns early on. But again, some of the basic expectations are there. Now, I will tell you what Dr. Wythian and we have been encouraging at the state level, and I mentioned it a few moments ago. The rate of positivity and transmission of the virus in a school setting is much, much lower than in the general population. Why? Makes sense. Restricted environments. School districts, faculty, students, and families are taking and using sort of heightened precautions to slow the transmission and to protect the health of students and others. That, I think, is important to note because outside of a school setting, is less restrictive. And again, going back to where we're seeing the cases emerge, they're coming from the less restrictive environment. You're getting casual with friends and neighbors, and we understand why. Believe me, I understand why you would do that. We're just asking you to hold firm a little bit longer, dig a little bit deeper, and let us get through. Let's take those precautions and follow those protocols to get through this together. Peggy. How many days do you have to go back for contact tracing from your first day of symptoms? Excellent question. It is sometimes slightly different, but this is the measurement. So you're considered contagious 2 days before symptoms, or 2 days before the positive test if you had no symptoms. So generally speaking, when you test positive, if you are asymptomatic, they will have you go back 2 days. So today is what day? Wednesday. We would go back Tuesday, Monday, and that would be the timetable that we look back for contact tracing. If you're symptomatic, they would go 2 days before symptoms. So let's say I test positive today, Wednesday, but I had a sore throat and a fever on Monday. They would go back Sunday, Saturday, Friday to that time period. Keeping in mind that your quarantine is also matched with that basic information. And again, it's the CDC has recommended, I think, 10 days now. The state of New York, which sets the guidance for the state of New York Department of Health, is still holding that 14 days. That could change, but as of today, it's basically 14 days. But it's based on when you test positive and when you may have been symptomatic. And so if you were symptomatic several days prior to testing positive, both the contact tracing period goes back in time, those extra days, and your quarantine could go back in time, and they'll to start in those basic days, and so the Department of Health and others would advise you of that. But to your point, you're considered contagious 2 days prior to the symptoms, so we would go back 2 days prior to symptomatic or 2 days prior to a positive test. And you should too, and think in your mind again, who was I in close proximity? I mean, this isn't the person in the car next to you at the traffic light. This is the person in the car with you at the traffic light. This is likely someone you've interacted with you may be in close proximity for a period of time, asking questions as you're at the grocery store, or a family a member or a friend. You'll be asked or a coworker, you'll be asked to go through those steps to identify. And again, the point is here to slow the transmission, and also to make sure they're aware that they may be at risk of contracting a virus that we don't have immunity for. That's all very, very important. If there are more questions, write them in the comment section below. Good question, Laura. New CDC guidelines is 10 days. When will Dutchess, New York State? Well, Dutchess won't be changing anything unless the state of New York Department of Health alters its guidance. Our health department functions both based on our own local concerns, but within the construct and the guidelines of the state of New York. The State Department, that's the law. They are, in fact, the county health department is actually an agent of the state health department. That's the way it works. The state, as I mentioned, has not yet changed those protocols, but at the end of the day, if the state does change those protocols, we'll be following them. Now, I will mention that has happened all along, and this is not just for this pandemic, but for other health concerns. The states, any state, health departments are generally a little bit lag behind the federal, so they do their own sort of review and analysis, and then they make those changes. So it's possible the state changes that to 10 days, but that hasn't happened yet, and if it does, the county obviously would follow that expectation from the state. But as I said, currently, depending on when you were symptomatic or when you test positive, you could actually end up with only a 10 or 12-day quarantine period, depending on when you identified those symptoms and when you may have tested positive. Maureen, will tests be allocated so all schools can remain open, not just smaller private ones, if we hit the yellow zone next week? Okay, well, first, let's be clear. In the case of a yellow zone, in order for a school to stay open, yes, they would have to conduct the 20% testing. That's public or private. Yes, we are going to work with schools, but there is no way to answer the question, will they all be able to meet that expectation? So again, and the reason that is that there is the infrastructure for testing is stressed nationally. It's not unique to Dutchess, and it's not unique to New York State. Nationally, access to the test kits, the staffing to provide the tests, and labs to conduct the tests, and the machinery to conduct the tests is all stretched very thin. We have over a dozen school districts in Dutchess County, and as I said, if a school district is, if it's a cluster in one district, that is certainly something that we think we can manage. If it's a cluster in several school districts, that's certainly something we think we can manage. If it's a cluster in all, not gonna be able to be managed. So, what I will say to you is this: again, step one is not up to Dutchess County, and it's not the direction of the state. If we enter a yellow zone as identified by the state of New York, and we'll know that, and I will tell you, we are likely to experience that within the next week. I think that is a fair estimation based on the rate of growth. And again, we can make choices to slow the transmission of this virus, and we ought to be doing that. In particular because, again, we want kids to get to school. We want our businesses to remain open. We want to get to some semblance of normalcy. If we enter a yellow zone, we identify first, number one, schools decide what they wish to do. Private schools have purchased their own machines, and some have purchased their own test kits. If they have the capacity through their own private expense to do that, they can do that. And that's something that government is not engaged in, but they can do that, meet the test, and stay open. The public schools have to decide if they want to stay open. As I said, we've created sort of this toolkit, if you will, that we're prepared to launch with a school district and the school districts. But again, do they want to stay open? If they do, we'll coordinate with them. If they don't, that's on them. And again, what I will tell you in some counties that have experienced this, you have to have 20% of the population in that district agree to be tested. You can't mandate testing. You can't force people to be tested. And they may choose ultimately that that's not what their district wants to engage in. And so they go remote. If they want to remain open, as I said, we'll be in a position, as I understand it, and the partnership we've created through these relationships we have with urgent care providers, healthcare providers, hospitals, and the districts, we believe we can sustain some level of microcluster testing. And the state, which has redirected the distribution of the test kits so that they can manage distribution themselves, the state has been making them available in counties where these clusters have existed. If there are dozens upon dozens of them across the state of New York, the state's not going to sustain that, and it's unlikely that districts would remain open. So that's where we are with that. Francine, if schools go full remote long-term, will consideration be given to keep children in special ed in for in-person learning? Excellent question that was actually asked of the governor and the governor's staff earlier this week. I will say this, and to his credit, he said it out loud, and I think it's worth repeating. We want to keep kids in school. No matter what the challenge is, we know that the transmission of the disease the rate is lower significantly in a school setting than outside the school setting. The trauma that young people will have experienced by having their entire school year upended will be lifelong. To think that it's not is fooling ourselves. This year is going to have a real impact on the learning capacity, the education, and the mental health of young people, period. That is compounded for kids with IEPs, special education services necessary. And I will say this, most districts have found a way, even with remote, to accommodate in-person education for special education students in most cases. Not every case, and before you start typing, it may not be your district or your school, but I will say in most cases they've attempted to do that. The governor has acknowledged in our conversations, meaning the county leaders with the governor, the governor's office, and the governor's staff, has acknowledged that there is a real need to make sure these services remain in person. In some instances they will. In some instances, we might have to argue for it, but it will be based on the numbers as they come available. But I will tell you, as an advocate myself and as the father of a child with a disability and IEP, we very much want to be sure that those in-person services, that they can be provided safely, continue. And most districts have worked to accommodate that. Rob, will vaccinations be distributed through our doctor's office? Short answer is at some point, yes. As you've gotten to know over these last 11 months, I don't give short answers. I wish I did. It'd be easier on everyone else. So, number one, County Executive Ryan McMahon, County Executive P.J. Wendell from Chautauqua County, and Ryan McMahon from Onondaga County and I have been asked to represent the county executives in New York on a regular sort of learning panel with other county leaders at the federal level. So we're interacting and we're getting updates from the CDC and the leaders of this Operation Warp Speed, this concept of creating this vaccine and getting it out onto the streets that the federal government and the White House task force has been engaged in. We're getting regular updates. The county executives had a session last week with CDC representatives and with New York State Department of Health. Every county has a distribution plan, a vaccine distribution plan. Had a conversation earlier this week. We had conversations earlier this week with the hospitals. Here's what we think is going to occur, and this is bound to change. The governor spoke about it a little bit today and yesterday. Number one, it is likely that access to one of these vaccines will be made available before the end of December, principally to frontline emergency responders first. So those who are on the front line responding would be given priority for round one. Round two, which is broader public access, would be other priority and other essential priority workers, including those at nursing homes. And we saw that today. The governor talked a little bit about the federal government's focus on getting nursing homes and nursing home access. So we expect that to be in the phase, if there's 3 phases in phase 2, if there's 4 phases, it might be phase 4. But phase 1, priority staff, emergency responders, frontline, hopefully to some degree, not universal, but to some degree, beginning before the end of December. In the month of January, the expectation is January into February, this next phase of more public rollout, next sort of priority personnel, nursing homes, nursing home staff. The third phase, which is likely late winter, early spring, so you're following along, likely April timetable would be broader public access, and then summer would sort of be universal public access. So what the state has said is hospitals may act as the hub. This is a nice way of saying things, a hub and a spoke, meaning hospitals become sort of the location where some of this is stored. And then individual providers like the Caremounts of the world, like the medical groups that we know, would be distribution points, and county governments would also be public distribution points for underserved populations. Now, underserved populations are individuals that might have financial concerns. In some cases, they may be minority populations if they don't have access to a hospital or care, or it might be remote locations, places in our community that don't have direct access to a hospital or to a healthcare provider. So the expectation is hospitals begin the distribution structure with healthcare providers and county governments. County governments providing access to those underserved populations, broad public access will be similar to what you see with the flu clinics, right? You'll see pharmacies providing access. You'll see your doctor's office having access, or they'll send you to an area urgent care for that access. I know that's a long answer, but that's the stages that we're aware of. This begins, we expect, before the end of December with priority populations and runs through and into the early part of summer where the general population, general public will be able to have access to the vaccine. Now again, having a vaccine is not the same as actually conducting vaccinations. So we obviously want you to be safe. We want you to make that choice. And what the FDA has done is remarkable in their review. What these scientists, these companies have been able to accomplish these last several months has been remarkable. And that's why, again, this will be this slow sort of rollout with priority populations and then general public over the course of, I would say, 6 to 7 months. Karina, will dentist's office be able to operate as normal? She's unable to social distance from patients and work with aerosols. Will they be able to operate as normal, or when will they be able to operate as normal? I mean, dentist's office can function to some degree now.
I think she's asking if they'll close.
Well, going back to those categories, so it's really, if there's going to be a closure, it's going to be the decision of the state government. But I would note, in a yellow zone they can function, and in an orange zone there might be limitations in their activity, but in the red zone is clearly areas that we would end up with certain closures. So as of this point, I will say this again, I really do not believe the governor wants to make the choice to close things down. So let's not let him. Meaning, let's take the steps that we ought to take in order to slow the transmission of the virus. There are certain basic protocols that we can all engage in that will be helpful, obviously, for your health and the health of others. I do want to mention a couple other, let's do a few non-COVID related items, and then if there are other questions, write them in the comment section below the live stream. We talked a little about the travel advisor. I do want to note Thursday, tomorrow evening, the county legislature will take action finally on the budget I've proposed for 2021. I want to offer my thanks to the budget committee on Tuesday night, Monday night, some night this week. Last week, the budget committee. Okay, I'll get to that. That's a good question. Supplies. Good question, Nate. I'll get to that in 1 second. So the budget committee last week approved my proposed budget. It's now really a product of the county legislature with a series of amendments. Very happy to support in a bipartisan manner. That committee adopted that budget, sends it to the full legislature. So let me be clear. For Thursday night, the legislature will consider our budget. There is no reduction in the delivery of service. I know that that's hard to understand and to believe. We have taken steps over the course of the last 11 months, and there's certain realities. There are certain services that we will not be providing in 2021 because under a COVID environment into the new year, we're not going to be providing them. It is unlikely we have senior center activities in January and February. There are operational adjustments and savings that are occurring that allow us to double down and really provide those other services that will be provided over the course of 21. So there is not a reduction in service. Mental health is most notably no reduction in our commitment to mental health, substance use disorder, and others. We are shrinking the size of the county workforce, no layoffs, and most positions are preserved. If the federal government comes forward with some federal aid, which we think is more likely, certainly over the course of the next several months, I will tell you as an observer and practitioner of politics, I'd be surprised if much happened before the special election in Atlanta, in Georgia, in January, and then of course with the incoming administration, it is likely that there will be active negotiation between the White House and then President Joe Biden's administration, the Senate, no matter what party happens to lead the U.S. Senate, and the House of Representatives. There is likely to be some federal aid. Or we start to see some increased economic activity, which is likely when we get past this point, when vaccines are more available and we can control this a little bit more. We expect as revenues grow, we'll backfill those positions. So we're not deleting them from county government. We're just defunding some of them so that we can manage. And we're asking employees, and believe me, I will say this, I have been not only amazed but heartened and grateful to Dutchess County's employees who really have dug deep, and they're going to the next 12 months. We can sustain that for another 12 months of real hard work to get the residents of this county the services that you deserve. So No tax increase, $18 million reduction in county spending, and a smaller workforce, but no layoffs, and a sustaining of those core responsibilities that we've focused on these last 8 years and the needs of our community. That budget comes to a vote on Thursday evening. My goodness. Okay, I'll get to that too. I've got Nate and I've got Diane. Hold on one second, Diane. Do want to mention some, at least some bright news. This weekend is our Illumination weekend at Wilcox Park, December 5th and 6th. We have about a dozen, I think, displays, organizations coming in to display. Our county park staff has decorated and been decorating Wilcox around the lake at Wilcox Park. The 5th and 6th. Please join us. It's a drive-through event, 6 to 9 p.m. at Wilcox Park in the town of Amenia on Route 199. On the 5th and 6th of December. Nate, there are people who can't get needed supplies. That is true. There are, first, please be sensitive. Just as we learned early on this pandemic, generally what happens is there is a higher demand than there is supply, and unnecessarily so. Meaning, there still is the flow of these products. There still is distribution lines. There are good and decent people driving trucks all around the country delivering these supplies. There is not a need to hoard them. There is not a need at this point to own a lifetime supply of toilet paper. And because we see people making those sort of large-scale purchases, we are seeing the slowdown and the reduction of supply. So to Nate's point, what can be done is just be sensitive about your own purchasing, recognize that the system still works, there still is distribution, there still is access to most of these products, although disinfectant is still a bit of a challenge. There will be challenges, but be sensitive, be responsible, be smart, be calm. Make those purchases that you need and allow others to also make those same purchases. But we recognize that there is a glutton supply and a reduction in a glutton demand and a reduction in supply. Sorry, really testing your skills today. Diane, is it true that schools might have to go full remote because of county having to test 20% of schools as Dutchess is over 3% positive? Short answer, no. Long answer, let's go to the red, orange, yellow. So, number one, and most importantly, if the county goes above 9%, schools have to close. That's the sort of standard countywide number. These are the cluster zones identified by the state of New York. And keep in mind, we have to have a 7-day rolling average above 3% for 10 days. And so because any community might be over 3 or 4% on one day does not necessarily follow that we are over 4%. So here's the way it works. These are cluster zones, and this is the framework. Yellow is the precaution. If the 7-day rolling average is over 3% for 10 days, and we've had 12 or more new daily cases per 100,000 residents, then an area within the county, not the whole county, an area within the county, could be a town, could be a city, could be a zip code, could be a census block, ends up in that zone, and the schools within that zone must test. If they choose to, they may choose not to test. They may choose, not because they don't have an access to test, they just may say, listen, it's not something we want to sustain, we're going remote. That's number one. So that's the framework that gets employed. And then going back to the red, yellow, and orange, if the school wants to remain open, then we must test 20% of the staff and students every 2 weeks. That's the expectation. So just keep that in mind. That is the structure. And if you're following anything at all, the screen that I have right here, you would take a screenshot of it, and the screen we just showed you are the two that are legitimate and important to note.
And there's some updates to it.
And there are some updates to it. Some that the state made available today, some that the state's going to be making available over the course of the next few days. So I will offer, and because they're going to be measuring hospitalizations and some other data points. But right now, this screen and the other screen are the two that we use as what you should know. And again, the concept here is they're microclusters for a reason. the state is saying within these defined regional areas, these defined geographic areas, this is the standard and the threshold that would have to be met and exceeded. So I hope that's helpful to you, Diane. If you have, if there are other questions, write them in the comment section below the live feed. If not, I do want to remind you, you can visit duchessny.gov to stay connected with us. If you have questions, we're going to live hotline. Are we taking live hotline calls now, or have we switched that over? Soon, right? Depending on call, let's pull up that slide. The two numbers that we want you to have that you should remember. We're back to reminding you this. The COVID-19 hotline is 486-3555. It's automated currently. As demand grows, we'll revert back to a live call. But again, even within that automated system, a live human will be in touch or communicate with you. But please follow the prompts at 486-3555 if you have a question. If you're experiencing or someone you know is experiencing some mental health concern, please reach out to Duchess Helpline, 845-485-9700. You can call or text that number. I have, on behalf of residents and neighbors, I have actually had individuals who are homeless reach out to me through Facebook messaging, and I've texted the helpline to connect them with services. This is something that I know all of this information is maddening, it's frightening, it's angering, it's disheartening at some times, and it's overwhelming. We provide these services, and we have consistently for these last 11 months because we want to be there to be helpful. Some people consider county governments as the sort of the government of last resort, meaning if you're not interacting with someone else or you're not able to provide help someplace else, you go to the county government. I do kind of feel that we are sort of the glue that holds certain things together. If you or someone you know, someone you love, someone you're interacting with is dealing with a mental health concern, anxiety, stress, diagnosed or otherwise mental health concern, substance use disorder, 485-9700, phone or text. We have professionals 24 hours a day, 7 days a week there to provide assistance. If you need to be seen in person, they'll communicate that with you. We have access through our stabilization center, which remains open. We had to convert for a period of time to telemedicine. We do still have in-person activity, and access. That's all an opportunity for you. We provide these services because we feel, one, because we feel they're critical, and two, because I mean this genuinely, we care very deeply about the people we serve. We care very deeply about those that we represent, and that's all of you. So with that, I appreciate you joining us today. We are going to be live with you next week, Wednesday, December the 9th at 3 p.m. If there is a need, and likely if we end up having to confront a microcluster, we might come live to you in the meantime. But we're scheduled for Wednesday, 3 p.m. on December the 9th. I hope we got to as many of your questions as we could. Well, we got to as many of your questions as we could. I hope we got to most of them. And I do want to thank you. I said this last week. Going into Thanksgiving was very small at my house. It was my parents who've been living with us for for over a month now. My children, my wife, and I. It was very sort of what I would call intimate, small. But I will say one of the things that I'm truly grateful for is the honor of serving you, and the other is that I do serve you, and we work for you, and we try our very best to give you what we can as far as information and reassurance. So take those steps we talked about, follow those basic protocols, small social gatherings, small gatherings. Don't let up, even in the more casual environment. Be sensitive to your health and the health of others. Remember physical distancing. Wear a face mask, face covering, very, very important, very helpful. Personal hygiene. If you're not feeling well, take stock of your own health. Obviously, call a physician. Isolate yourself. Don't go to work or school if you're not feeling well. Take those personal hygiene steps that are so very basic, but we continue to remind them. And in the meantime, stay strong, keep healthy, and be kind to each other.